Good afternoon, ma'am, and good afternoon to all my friends. Today I'm going to give a presentation on National Vector-Borne Disease Control Program, in short NVBDCP, presented by myself, Purnima Rabha, a student of Post-Basic BSc second year, roll number 2. Now we will see first the introductions. Vector-borne diseases are infections transmitted by the bite of infected arthropod species such as mosquitoes, ticks, sandflies, and black flies. Here is the image of the mosquito-borne disease, mosquitoes. Um, in left side we have the upper image is the tick, and the lower left side lower image is the image of black flies, and in the right side the upper image is the image of mosquito, and the lower image is the image of sandflies. So under the umbrella of National Rural Health Mission for the prevention and control of 6 vector-borne diseases, namely malaria, kala-azar, filaria, Japanese encephalitis, dengue, and chikungunya, the National Vector-Borne Disease Control Program was schemed on 2003. The National Vector-Borne Disease Control Program is one of the most comprehensive and multifaceted public health activities in the country. Factors increasing the risk of vector-borne disease outbreak are increasing urban population, shortage of water supply, traditional water supply, poor garbage collection, rapid transportation. Now we will see the historical perspective of National Vector-Borne Disease Control Program. National Malaria Eradication Program (NMEP) was being implemented in the country since 1958 and was reviewed in 1977 and revised guidelines for Modified Plan Operations (MPO). In pursuance of the expert committee recommendations, the director of NMEP, that is National Malaria Eradication Program, brought out operational manual for Malaria Action Program (MAP) in 1995. Continue with the history perspective of National Vector-Borne Disease Control Program. National Malaria Eradication Program was renamed National Anti-Malaria Program in March 1999. Directorate of National Anti-Malaria Program was dealing with 3 centrally sponsored schemes, namely malaria, filaria, and kala-azar control, and in addition was looking after the prevention and control of dengue and Japanese encephalitis. With a view to coverage dengue, Japanese encephalitis with the 3 ongoing centrally sponsored schemes, that is National Anti-Malaria Program, NFCP, and Kala-Azar Control Program, and also same with the similar strategies of every program, the integrated scheme was renamed as National Vector-Borne Disease Control Program, that is NVBDCP, from 2nd December 2003. Now we will see the objectives of National Vector-Borne Disease Control Program. The 2 objectives of National Vector-Borne Disease Control Program were to prevent mortality due to vector-borne diseases, to reduce morbidity due to vector-borne disease. Now we will see the strategies of National Vector-Borne Disease Control Program. The strategies for both rural and urban areas under National Vector-Borne Disease Control Program are: first, disease management, which includes early case detections and complete treatment, strengthening of referral services, epidemic preparedness, and rapid response. And the second strategies are integrated vector management, which include indoor residual spray in selected high-risk areas, use of insecticide-treated bed nets, use of larvaceous fish, anti-larval measures in urban areas, source reductions, minor environment engineering. The third strategy is the supportive interventions, which include behavioral changes communication (BCC), public-private partnership, human resource development through capacity building, operational research, monitoring and evaluation, environment management, which include proper disposal of solid waste, improve water storage practices, control of mosquito genetic environment by avoiding indiscriminate disposal of containers, tires, junk material, etc. Overall environmental sanitation and hygiene. Now we will see the six vector-borne diseases one by one. So we'll first see the malaria. The malaria caused by Plasmodium parasites is worldwide problem and one of the serious public health problem in India. At the time of independence, malaria was contributing 75 million cases with 0.8 million, that is 8 lakh, deaths every year. To combat or to fight this major health problem, a World Committee in 1946 recommended to plan and implement comprehensive malaria control program, which was endorsed by the Planning Commissions in 1951. Continue with the malaria control program. In April 1953, Government of India launched a National Malaria Control Program (NMCP). Since then, the national program against malaria has undergone a series of development to combat or to fight the problem. The states with high incidence include the Assam, Arunachal Pradesh, Tripura, Meghalaya, Chhattisgarh, Jharkhand, Madhya Pradesh, Andhra Pradesh, Orissa, Maharashtra, Gujarat, Rajasthan, West Bengal, and Karnataka. The objectives of malaria control is to bring down its prevalence or the spread of the disease to a level that there is no more serious health problem, and to maintain and to achieve low level of spread or the cases in each state. The strategies under malaria control program is the residual insecticide spray of human dwellings and cattle sheds, monitor the incidence in the control areas, anti-malaria drugs were made available for patients, spread reporting to an institution. There are various programs, schemes, and projects that are maintained under the malaria control program. First, we have is National Malaria Control Program in 1953, National Malaria Eradication Program (NMEP) launched in 1958, Urban Malaria Scheme in 1971, Modified Plan was launched in 1976, and Enhanced Malaria Control Project in 1997. National Anti-Malaria Program (NAMP) launched in 1998, Intense Malaria Control Program (IMCP). Continue with the program. Intensified Malaria Control Project 2018, National Malaria Strategies Plan during 12 5-year Plan 2012 to 2017, National Framework for Malaria Eliminations in India 2016-2030. Second, we have is Kala Azar. The Kala Azar or visceral leishmaniasis is a chronic disease caused by an protozoan and transmitted to man by the bite of female sandfly. Currently, it is a main problem in Bihar, Jharkhand, West Bengal, and some part of Uttar Pradesh. The cases rise gradually during 1970 onwards. Control Program. The Kala Azar Control Program was launched in 1971 by the Government of India. During the 11th 5-year plan, the goal of elimination of Kala Azar was set up. The target was to reduce annual incidence less than 1 per 10,000 at the subject district level by 2010. Strategies for Kala Azar is interruptions of transmissions for reducing vector populations by undertaking indoor residual insecticide spray twice annually, early diagnosis and complete treatment of Kala Azar cases through active case search from door to door by peripheral health workers and volunteers. Continue with the strategies, information, educations, communications for community awareness and community involvement was carried out. Capacity building, monitoring, supervision, evaluations and research are carried out. Until 2000 to 2001, the program was operative on cost-sharing basis between the center and the state. To realize the goal of elimination of Kala Azar, the government of India is spreading a 100% support to endemic states from 2003-4. Intensive undertaken for Kala Azar eliminations in number one, active case search. The active case searches are carried out during a fortnight, designed as the Kala Azar fortnight. Institutional surveillance. The cases are reported from primary health centers and public health hospital and treatment to ensure complete treatment compliance. Vector control. 2 rounds of DDT spread are given in the affected blocks of the district at a dose of 1 gram per meter square. In 5 health education program with personal contact as well as through mass media, the program organized a health education program for the community people. An intensive training program. All level of health staff, more than 150 medical officers were trained in endemic state during 2005 and 6. Introductions of rapid diagnosis and oral drug multifosin are provided. 200 villages of a district selected for focus interventions. The Kala other activities, the ASA under NRHM were provided incentives. Third vector-borne disease is the filaria. So let's see. The filariasis is prevalent all over the world and it is a serious problem in the tropic and subtropic regions of Asia, Africa, Western Pacific and other parts of America. In India, filariasis is a major and serious public health problem because of social stigma attached to it due to physical disabilities and great suffering of the person infected with filaria. The highly infected states include Kerala, Andhra Pradesh, Tamil Nadu, Orissa, West Bengal, and some parts of Madhya Pradesh, Bihar, and Uttar Pradesh. The causes of filariasis in India is due to Wucherenia bronchopti, which is transmitted to men by the bite of infected mosquitoes, Culex, Anopheles, Monsonia, and Aedes. Symptoms include first, in initial stage, there is no any sign and symptoms for filaria, but later stage and there will be a symptoms of fever, kidney damage, skin abnormalities due to the bacterial infections, and elephantitis, that is swelling of limbs and genitalia. And here is the image of men with elephantitis limb, there is elephantitis and swelling of genitalia. The control program of filaria. In 1953, it was estimated that 25 million people were living in filariasis endemic areas. So, for the control of filariasis, the National Filaria Control Program was launched in 1955. Strategies for the eliminations of filariasis in India. Annual mass drug administrations (MDA) of a single dose of anti-filarial drug DEC and albendazole in endemic areas for 5 years or more to eligible populations, except the pregnant mother, lactating mother, and less than 2 years old children. Home-based management of lymphoedema cases and upscaling of hydroxyl operations in identified CHCs, district hospitals, and medical college hospital. Demonstrations of washing of feet to maintain food hygiene for the prevention of fungal and bacterial infections.